Well, now that several lawmakers and communities declared racism a public health issue, what does that really mean? And how will it solve the problem? Senior health correspondent Monica Robbins explains what needs to be done.
Calling racism a public health issue is not a new concept. Making it widely accepted is, and here's why it's important. Studies show African Americans are often uninsured or live in communities with low-quality health care. Research shows African Americans receive worse medical care even when income, education, and socioeconomic status are taken into account. Missing that care led to an increase in pre-existing conditions such as diabetes, hypertension, and heart disease, conditions known to put them at higher risk for coronavirus.
And COVID-19 certainly shined a light on the disparities in the economic and workforce systems and also health care.
African Americans also disproportionately make up the majority of low-wage essential jobs, including grocery and factory workers, jobs that can't be done from home, again putting them at higher risk for COVID.
We want to see more diversity in upper management and more investment into the community.
But connecting racism and health officially also means those in power have to find solutions.
And by declaring this as a public health crisis, it requires our legislators to put together legislation that's going to solve the problem.
The pandemic is only an example of how racism affects health. We already know infant mortality among black women is 4 times higher than whites.
You can't explain that disparity apart from structural racism.
Racism damages the core of communities that allow them to thrive. So by recognizing it and acting on it, it helps all of us. And one day, maybe we'll start listening to the wisdom of children.
I want to see people getting together and having fun, not being mean to each other.
Out of the mouths of babes. And I think we can all agree it's truly unacceptable that in Cuyahoga County, your zip code can dictate your life expectancy on average. And that's what local health officials are trying to change. There are programs addressing the issues, but more awareness and more funding are critical in helping them succeed. And our local hospitals have also been involved, with Metro Health taking the lead with more innovative programs, Laura.
Hearing words from that, from children, you're right, so powerful. Monica, thank you.